I am Derese, 49 years of age and an Ethiopian. I came here for the lung treatment for the lung cancer disease or problem I had. It was back in April where I came to know that I had a tumor on the right side of my lung, and I had to look for the best medical facilities and treatments worldwide, where I came to know that Yashoda in Hyderabad is the best one. I came here and went through a series of medical treatments here in Yashoda Hospital. I went through the lobectomy operation. I went through the chemotherapy and radiation therapy. I am thankful for the Yashoda Hospital medical staff, especially for Dr. Sreekanth, who is a consultant oncologist who did lung operation, and his entire staff and crew members. I'm also thankful to Dr. Nikhil, who took me through the chemotherapy treatment, and Dr. Kiran, who took me through the radiation therapy. And now I'm feeling good. The tumor is no more there. I'm safe and I am in good health status. I'm thankful for the entire Yashoda Somajiguda staff. The coordination and the treatment of the entire staff of Yashoda Somajiguda is wonderful, from the supportive staff, administrative staff, from transport staff, the wheelchairs up to the senior consultants and high-level doctors. It's a coordinated and one targeted effort, and that is really wonderful, which the hospital has to keep on. And I'm really thankful for all the services I had and for this opportunity. Thank you very much.
This is regarding with this gentleman, Mr. Derese, who has come from Ethiopia. When we first investigated him, he was found to have a locally advanced right upper lobe lung adenocarcinoma, and we initially gave chemotherapy because it was stuck to the pleura and stuck to the mediastinal pleura and then the costal pleura, and it was not initially suitable for surgery. So we gave him a course of neoadjuvant chemotherapy of 3 cycles, then followed by we got a PET scan assessment scan done, and we found it definitely there was a partial response, and it was then suitable for a surgical resection. Then we called this gentleman back, and after adequate workup, we took him up for a surgery, which was done by a minimally invasive procedure technique, which we call it as thoracoscopic or VATS procedure, wherein we make a small incision, and then through the camera and then the instruments which we use to mobilize and then manipulate the tumor and then the vascular structures, though it was stuck reasonably badly, it was a tough case to surgically to remove it. We could successfully do it because of the extensive and then advanced equipment what we had here. We could remove the upper lobe for him and then preserve the lower lobe. We used the laser as well as staplers to resect the lung and also resect the vascular structures. So post-operatively, from the day 3 onwards, he could walk. He was in the ICU for only 1 day, and from the 3rd post-op day, he was up and walking. He was having his food from the 2nd post-op day. Unfortunately, he was also an young patient, so he could manage to mobilize him soon after the surgery, basically because of the age as well as the minimally invasive technology what we used by what we call it as VATS. So he was discharged on 5th day from the hospital, and then by 10th day his sutures and the tube were all the tubes were out, and he was, I think by 2 weeks he was almost near normal as what he was without the cough. So he had cough even before surgery in spite of the chemo because of the tumor. His cough has drastically came down of surgery. He could walk without much of discomfort, without cough and without breathlessness. And maybe after the surgery, from the 3rd week or 4th week, he completed his further courses of chemo and radiation, and we could successfully send him back to his country in a reasonably fit and normal condition.